see in present world, a lot of cardiac diseases are generally asymptomatic. As you told about blockage of coronary artery disease, people are roaming here and there and they are perfectly normal. But at the end, ECG is normal, echo is normal, and at the end, when they go for angiography, they are diagnosed with some 100% blockage, some 70% blockage. So if a person is having a 100% blockage or a 70% blockage, does he really need any cardiac intervention?
Yes, depending on the circumstances. So the first part of the question is, are some people truly asymptomatic from heart disease and go undetected for years? That is true, it can happen, especially if they are diabetics. Diabetic patients tend to not have the typical symptoms. Women also don't have the typical symptoms. They tend to have very atypical presentation. So one has to be very aware that there could be atypical presentations, especially in these two subset of patients. So women quite often may not present as chest discomfort, chest pain, left arm pain, shortness of breath. They may just present as, I'm not feeling too good, I just feel a little tired, I just feel a little short of breath. They may not present as chest pain. Diabetics especially, sometimes they will not present as chest pain. Women are somewhat protected from heart disease before menopause, which is less than 45-50 years of age. But beyond that, they accelerate. Their heart disease risk tends to accelerate and they catch up to men by a decade or so. They are neck to neck with men by a decade. In fact, even in India, I believe, more people die of heart attacks than all cancers put together. We have so much awareness about cancer, but more women die of heart attacks and heart disease than all cancers put together. That is true in the United States. It's probably even more so in India. So the second part is, if somebody is going for an angiogram, it usually means that the physician has seen some signs and symptoms which, if not typical, has some atypical features which raises suspicion within the physician that this could be a representative of heart disease. Otherwise, typically a physician would not want to do an invasive study just off the bat. He would have done some tests and it would have raised his or her suspicion that this could be heart disease and it's better to check it out by an angiogram. And the third part of the question that was, does 100% or 90% block needs to be treated? Let's first decide what a true blockage is. If I were to do an angiogram in a young person like you, I may not find any heart disease. But by 40s, you may find some blockages like 20-30%. That doesn't need to be treated with a stent or something. It just needs diet and exercise and lifestyle modification. We treat blockages which are flow limiting. Flow limiting, what does that mean? It means when there is a demand-supply mismatch which may occur. If there is a blockage which occurs and if we start to exert ourselves, the oxygen demand of the muscle increases, and if there is blockage in that territory, blood supply cannot increase to meet up with the demands of that muscle. That creates a demand-supply mismatch, and that's when the muscle starts to get, I can't breathe, I need more oxygen, I am getting tired, starts to not keep up with the demands of the body, the person starts to feel short of breath and he stops. He can't exert anymore. That flow limitation starts to occur at 70% blockage or greater. That is the target, that is the threshold where we start to say that needs an intervention of some kind, like a balloon or a stent or bypass surgery if necessary. Does 100% block need to be treated? Answer to that is yes or no. It's a complicated situation. In most cases, yes, especially if it is acute. However, in certain individuals, they may have 100% blockage for 5, 10, 15 years, we don't know. And there are 3 arteries which supply the heart. If one of them is blocked and the blood supply from the other 2 is able to compensate for the blood supply of the third one, then it is not necessary to open up that 100% blockage. But if somebody has 100% acute blockage, like an acute heart attack somebody is having where the artery is closed up, it is absolutely necessary to open up that blockage, because otherwise that muscle which is that is being supplied by that territory will die, and it will complete a process which is known as infarction. And that person, if the muscle dies, the heart becomes weak. If the heart becomes weak, they go into heart failure. That's how they all are linked together. If certain portion of the muscle doesn't work, the valves are tied to some muscles which are known as papillary muscles. If they don't work, the valves don't work very well, then the valves start to leak. So there are consequences of heart attack which are terrible if not treated very acutely. People can have very poor quality of life if the heart attack is made to progress forward without having any acute intervention.
Indeed, that was a very good answer for our viewers as well. सर, मैं आपसे अब ये पूछना चाहती हूँ कि अब जनरल पब्लिक क्या करें कि उन्हें हार्ट डिजीज कैसे वो अवॉइड कैसे कर सकते हैं?
पूरी हार्ट डिजीज अवॉइड किया नहीं जा सकता, बट जैसे आप स्किन कैंसर का पूरी अवॉइड नहीं कर सकते, आपको तो बाहर जाना ही पड़ेगा, सन में जाना ही पड़ेगा, उसी तरह से पूरी अवॉइड तो नहीं कर सकता, बट वी कैन ऑलवेज डू समथिंग, जैसे आप अपने रिस्क को कमा सकते हैं। तो इंडिया में स्मोकिंग का प्रॉब्लम बहुत ज़्यादा है, विच इज़ वन ऑफ द बिगेस्ट रिस्क फैक्टर्स फॉर कोरोनरी रिस्क प्रिवेंशन, for coronary disease. Alcohol is another one, although that has more risk towards electrical issues of the heart. Arrhythmias have something to do with alcohol. Smoking has a lot to do with the plumbing problems of the heart. दूसरी बात है कि genetics में यह है कि आपके यदि पेरेंट्स, आपके ब्रदर सिस्टर में किसी को हार्ट डिजीज है, especially at an age group less than 65, then you may be at a high risk for the same thing. It is very important कि आप अपने फैमिली हिस्ट्री के बारे में जानें कि फर्स्ट साइंस ऑफ हार्ट डिजीज आपके फैमिली मेंबर्स में कब आया था। फर्स्ट साइंस उनका बाईपास हुआ था एट द एज ऑफ 85, बट उनका हार्ट अटैक पहला हुआ था एट द एज ऑफ 55. दैट मीन्स यू टेक द स्टार्ट डेट एज 55, नॉट 85. और जो भी एज है उससे -20 कर लीजिए. दैट इज द एज एट विच यू शुड बी केयरफुल. व्हाट डज इट मीन बाय बीइंग केयरफुल? केयरफुल मीन्स कि आप यदि डायबिटिक हैं और आपको चेक नहीं हुआ है और आपकी फैमिली हिस्ट्री में डायबिटीज़ का फैमिली हिस्ट्री है, तो आप अपना चेक कराइए कि आप डायबिटीज़ आपको है कि नहीं. जस्ट अ सिंपल टेस्ट लाइक ओरल ग्लूकोज और ओरल ग्लूकोज टॉलरेंस टेस्ट और हीमोग्लोबिन A1C, HbA1c के नाम से जाना जाता है, वो टेस्ट कर ले तो आपको पता लग जाएगा कि आपको डायबिटीज़ है. यदि है तो आपका डायबिटीज़ कंट्रोल में है कि नहीं. इट इज़ वेरी इंपॉर्टेंट. Diabetes does not kill people acutely like heart attack does, but it kills people slowly. It will put them at a very strong risk for heart attack. It will put them at a very strong risk for stroke. It will put them at a very strong risk for losing their eyesight or their limbs. They don't die immediately, but they die a miserable death if diabetes is not controlled. दूसरी बात है कि कोलेस्ट्रॉल कंट्रोल होना बहुत ज़रूरी है. यदि स्पेशली किसी के फैमिली हिस्ट्री में हार्ट डिजीज़ है, उनका कोलेस्ट्रॉल एटलीस्ट 10 to 15 years before the onset of heart disease in the family member should be controlled, and if necessary उसमें स्टैटिन देना ज़रूरी होता है. अटोरवास्टैटिन, रोसुवास्टैटिन, सिम्बास्टैटिन, कई अच्छे स्टैटिन मेडिकेशंस आजकल अवेलेबल हैं. वन ऑफ द मोस्ट इम्पॉर्टेंट थिंग एस्पिरिन. कई लोग पूछते हैं कि एस्पिरिन का क्या रोल है इसमें. मेरे हिसाब से एस्पिरिन, एक बेबी एस्पिरिन जो इस देश में मिलता है, once a day is a very useful thing, especially आपकी यदि फैमिली हिस्ट्री में अर्ली ऑनसेट हार्ट डिजीज़ है. आपको यदि हार्ट डिजीज़ डायग्नोज हो चुकी है तब एस्पिरिन लेना ज़रूरी है. Unless somebody is allergic to aspirin, एस्पिरिन लेना ज़रूरी है. It is protective. Last but not the least, diet and exercise. इसके बारे में बड़े सारे क्वेश्चंस मिलते हैं मुझे। एक्सरसाइज मैं नहीं चाहता हूँ कि आप मैराथन में चले जाएं, जितना हो सके आप करें। सिटिंग आइडल इज़ वेरी बैड, उससे कुछ नहीं होता है। एक्टिविटी ऑफ एनी काइंड, आप यदि प्राणायाम करना चाहते हैं, योगा करना चाहते हैं, रेगुलर एक्सरसाइज करना चाहते हैं, भाग दौड़ करना चाहते हैं, फुटबॉल खेलना चाहते हैं, कुछ भी करें, those things help to improve the heart muscle and the heart health. Last is the diet. Diet, yes, it is important to avoid fatty food, but fat is not the only thing. It's the total amount of calories which you have to be careful about. Most of the calories in our diet comes from carbohydrates. The carbohydrate जो हम लोग खाते हैं वो fat में convert हो जाती है. That can be very dangerous. Most fat doesn't come from fat in the diet. Most fat comes from carbohydrate in the diet. Carbohydrate rich food like food rich with rice, chapati, puri, aloo, ये सारे carbohydrates हैं. Food rich in vegetables, fruits, nuts, they are low in carbohydrates. Food rich in carbohydrates, bad. Food rich in वही same amount of calories यदि आप vegetables में लाएं तो आपकी diet आपको ज़्यादा benefit मिलेगा.
Sir, what awareness would you like to share with the people who are suffering with heart disease or the people who are not suffering with heart disease?
For the people who are suffering from heart disease, one, accept that you have heart disease. So take your medicines on time. Once you have heart disease, especially outside rhythm issues, typically those patients will require to take medicines for life, especially heart related medicines. Please don't stop your medicines. That can have disastrous consequences. For people who have not been diagnosed with heart disease, the general things which apply to the rest of the population, which means diet, exercise, watch what you eat, have a healthy lifestyle, have a healthy balance between life and work and the stresses of life, is essential to leading a healthy life. Those things are common sense. कि क्या आपको खाना है, क्या चीज़ आपको avoid करनी है. Somehow that has percolated to general public, but it doesn't harm to reiterate to limit the amount of calories that you consume, to eat more vegetables, more fruits, more nuts rather than to eat carbohydrates. Fried food is not good, that we already know. Yoga, pranayam, these things are helpful to the body. In fact, there are some studies which came out from the United States where they have found some benefit for these things. However, these accumulate with time. That is not something, if somebody has heart disease and they start doing pranayam, it will not take effect immediately. It is something that will accrue with time. Same thing with exercise, same thing with diet. These things take time to actually show its benefit. But if you don't have heart disease, people who have heart disease suddenly become very conscious, of course. People who don't have heart disease may be able to postpone their heart disease by 10-15 years if they were to follow those recommendations. Last but not the least, do not smoke. That is one deadly thing that they can do to themselves. It's like putting your feet on the accelerator going towards disaster. It's like James Bond ke sequence mein, if you hit the self-destruct button, that's what you're doing.
Okay, sir, one last question I would like to ask you. Suppose if a person is having a heart failure or is going to have heart failure, what are the signs and symptoms he should keep on his mind and he should be alert at that time?
So heart failure के कुछ signs and symptoms है कि shortness of breath, तो आपको सांस लेने में दिक्कत होगी, especially while lying down. कई बार वो सारे patients, they don't lie flat, they will use lots of pillows under their head and they keep themselves more and more inclined. That means their heart failure is getting worse. They will quite often have subtle signs like legs will start swelling up, they won't be able to walk, they could walk maybe 1 kilometer, now they can hardly go from room to the kitchen and they get short of breath. That's a sign of heart failure starting to happen. Sometimes cough can be a sign of heart failure. Sometimes chest squeezing can be a sign of heart failure. Sometimes chest x-ray which looks like a pneumonia is actually heart failure underneath. that has not been diagnosed. Sometimes on chest x-ray the heart will appear very large. That's a sign that the heart may have failure issues underneath.
Sir, in conclusion, you would like to share something with Odisha State Open University?
I am glad you guys are doing this. It is one way to disseminate this information to a large audience of people. That's a very laudable effort actually on your part and the university's part. I'm glad to be a part of this, and I hope this reaches a large audience so that they can implement both medical, non-medical fields, so that they are able to implement small changes in their lifestyle and life in general, so that they can lead longer, healthier lives.
Thank you so much, sir. Thank you very much.